Welcome to the Radiology Department at Indiana University Health Riley Hospital for Children. Your medical doctor has requested an imaging test called a fetal MRI. This is a non-invasive imaging study that uses magnetic fields to create images of you and your baby. No X-rays or radiation are used for this study. The images created will be interpreted by a radiologist who has specialized training in pediatric and fetal imaging. You will meet with the radiologist at the end of your study today to go over the preliminary results. A full report of the final results will be available to your OB physician in 1 to 3 days. You have likely already had an ultrasound of your baby. Ultrasound is an imaging study commonly used to evaluate pregnancy. However, in certain cases, ultrasound evaluation can be limited, and a more detailed exam is necessary to see structures more clearly. Fetal MRI is often the next step if there is a finding on ultrasound that requires further evaluation. MRI is often better than ultrasound at identifying details, and it is also able to see the entire uterus and baby all at once. While studies looking at MRI during pregnancy are somewhat limited, in the past few years much more new information has been published. Recent studies, including one large study with more than 1 million participants in their first trimester, have looked into the safety of MRI at all stages of pregnancy and found no increased risk of harm to the fetus for those who received MRI compared to those who did not. The American College of Radiology currently states that pregnant patients can undergo MR scan at any stage of pregnancy, as long as her doctor and her radiologist agree the test is necessary, as present data have not shown harmful effects of MR imaging on the developing fetus. You may have heard that there is some controversy about using a contrast agent called gadolinium in pregnant women. However, we will not be using any contrast agent during your MRI. Not having an MRI performed would be the alternative. However, given your particular pregnancy, your doctors feel it is necessary to further evaluate your baby before he or she is delivered. This would allow them to prepare in advance for any procedures necessary once the baby is born, to better counsel you regarding your baby, or even to offer the possibility of intrauterine procedures before birth. You will be lying on your back during the exam. If you are uncomfortable at any time, we can alternatively position you on your side. Be sure to use the restroom before your exam begins, as you will be lying on the table for approximately 45 minutes, or sometimes longer if more imaging is needed. You will have to hold very still during this exam in order to get good images. Sometimes more images need to be taken if the baby is moving around a lot. Your technologist will instruct you during the exam. The MRI machine produces loud noises, so you will wear protective headphones during the exam. We will give you an option of listening to music or watching a movie during your exam to make you more comfortable. At the end of this video, we will have you sign a consent form indicating that you understand the risks and benefits of your study today and that you agree with having a fetal MRI performed. Please let us know at any time if you have any questions. Thank you for choosing IU Health, and we look forward to taking care of you.